This is Medic 15. We have a 72-year-old Caucasian male reporting acute dyspnea, lightheadedness, and palpitations. He is tachycardic, appears to be an atrial fib, no chest pain.
Vital?
BP 135/90, pulse approximately 130, irregular, respiration 20.
Saturation?
89%, we are en route, about 6 minutes out. How you doing, Mr. Bergen? Are you feeling any chest pains at all?
No.
Okay, good. Are you still feeling lightheaded?
What? A little dizzy. My heart is racing.
Do you know if your father has any history of heart disease?
No, Dad. Any heart problems before? Maybe. I mean, his doctor did get him to stop smoking.
Do you know when?
Dad, when did you stop smoking?
When I was ready to.
He's always been stubborn. I don't know, maybe 5 years ago? I'm sorry, my mother knew all this stuff, but she passed away a year ago, so.
Is this Mr. Bergen?
Yeah, atrial fib, rate approximately 130, BP 135/90, O2 sat, 89%.
Sorry, what?
Saturation, 89%. He still reports feeling shortness of breath.
Okay, let's get him into room 2. Any meds?
No, he's visiting from Seattle. This is his daughter, Karen.
Karen, hi, I'm Anna Lopez. Do you know, is your dad taking any medication?
I think that he's taking something for his heart, but I don't know, there may be others too, and he must have left him at home in Seattle.
Okay, you know what, the doctor's on his way. Let's just see what he has to say, and don't worry, your dad's in good hands.
So what's the story?
He's an atrial fib. He's got a heart rate about 120, 130. His blood pressure's about 120/70.
Okay.
No information yet on meds or allergies.
Okay.
And that's his daughter.
Okay, thanks. Hi, Mr. Bergen. I'm Dr. Sung. How are you feeling?
What the hell you asked me that for?
Has anything like this ever happened before?
Last 2 weeks, a couple times I was short of breath and a little dizzy, but not like this.
Okay. Listen to his heart. Okay. Has anyone ever mentioned that you have a heart murmur?
Oh, yeah, but they said it wasn't anything serious.
Okay, did you see a heart specialist? Okay, did the specialist mention mitral stenosis?
Might have.
Okay. Are you taking a blood thinner?
Oh, I take a heart pill.
Okay, do you remember what it's called? Did you have rheumatic fever as a child?
I don't know. That was a long time ago.
Okay. Any idea?
No, I'm sorry, I don't know.
Is there anyone that we can call? Do you remember your doctor's name?
No, never see the same doctor twice.
He's probably in pulmonary edema. I don't want to risk cardioverting until we find out if he's ever been in atrial fib before and is anticoagulated. Hate to knock a clot loose and give him a stroke. God, I sure wish we had his history.
Come on, Dad, hang in there.
Head to county.
Oh, I have his Medicard.
Thanks. How you doing, Mr. Bergen? Are you having any chest pains at all?
No.
Okay, good. Are you still feeling lightheaded?
What? I'm a little dizzy.
Okay, try to relax. We're gonna be there in a few minutes.
It's gonna be okay.
Is that Mr. Bergen?
Yes, and his daughter, Karen.
Okay, get him set up in room 2. Karen, hi, Anna Lopez. Do you know if your father took his Coumadin today?
I don't know because he doesn't have any pills with him.
Okay,
Can I stay with my dad?
absolutely, go right ahead.
Hi, I'm his daughter, Karen.
Hi, Karen. I'm Dr. Sung.
Thank you
Excuse
for
me.
being here.
You bet. Hi, Mr. Bergen. I'm Dr. Sung. How are you feeling?
Not too good.
Has anything like this ever happened before?
Last 2 weeks, a couple times I was short of breath and a little dizzy, but not like this.
Okay, let me take a listen. Okay, take a deep breath. Okay. Well, it looks like you've developed an abnormal heart rhythm called atrial fibrillation. That's why your chest feels like it's pounding, causing the fluid to back up into your lungs, so you're short of breath too. You just try to relax. We'll get your heart beating normally, and you should feel better in no time. Okay? Okay. Let's get him some diltiazem, 15 milligram IV over 2 minutes. You doing okay?
I'm okay.
Okay, let's go over here and talk. Well, your father's fine for now. We're taking care of his breathing problems and irregular heartbeat. Okay. I'd like to watch him here tonight and do some further tests tomorrow.
Tests?
Well, one of his heart valves was damaged by rheumatic fever in childhood. And over the years, it's gotten worse. That's probably what's causing his symptoms. I'd like to do an ultrasound and some other tests to look at the valve and see if it needs to be replaced.
What, you mean heart surgery?
Let's see what the ultrasound shows, and then we can review the alternatives and decide what's best for your father. You know, this is a good thing, Karen, catching this when we did.